and good afternoon. I'm News 4's Kay Ingram, and if you are joining us, I would like to welcome and introduce to you Dr. Cioe Pena, who is with us today. How are you?
I'm great. Thanks for having me.
Oh, thank you for being here. So for those of you who are watching now, maybe you've missed the last few lives we've done earlier in the week, but we have been taking your questions and getting them answered, which is what we're doing today as it relates to the coronavirus, right? We've been seeing updates just like out of the wazoo, it feels like, right? Every day. But Dr. Cioe Pena here is going to get those answered. So let's get right into it. One question we got is, why aren't people being tested for COVID-19 when going to the hospital for flu-like symptoms?
So that's a great question. It's a question we're getting constantly. And, the real answer is that there just right now aren't enough tests. Ideally, for epidemiologic purposes especially, we really would want to have everybody tested so we can tell, are the numbers going up, by how much? But I'll be honest with you, for mild to moderate symptoms where you're going to get better on your own, the test is almost not important to you as an individual. There's nothing that we're going to prescribe. There's nothing that we're going to be able to do for you that's going to change the course of this sickness. It's going to be mild. You're going to rest at home and get better on your own. And whether you have COVID-19 or a flu, there's actually not much to do at the point that you've already been sick. One of the things that we're telling everyone to do, whether they get the COVID test or not, is to self-isolate. So if you have a fever and a cough and you go to your doctor, you call your doctor and they advise you to stay home and self-isolate, please do that. Please distance yourself from family members that may be at risk and kind of take care of yourself.
All right, and another reminder right before we got started, even when we greeted, right, we did our quick elbow
bump.
Take note of that, y'all. That is coming in handy, right?
Yeah, we're telling people to just be very careful about contact. Our hands are kind of some of the dirtiest parts of our body, so wash those regularly. Might be mindful of touching surfaces and touching your face or shaking other people's hands. That's kind of the main way that this is getting transmitted. So we are trying to make people aware of how many times we contaminate our faces with our hands.
Which is so much. Oh my gosh, if you just keep track in any day, it's crazy. All right, so just a reminder, you are tuning in to our live Q&A for the coronavirus, right? We are taking your questions, and we have been all week on our website, and we're getting them answered right now. So if you happen to have a question right now where you're watching, right, be it on Facebook, on Twitter, comment below, right? We will take those live and get those answered for you. So next up, Dr. Cioe Pena. Someone wants to know, I am on immunosuppressant drugs. Oof, I nailed that. Immunosuppressant. If y'all see this word, it's a long one. Immunosuppressant drugs. Should I stop taking them due to the coronavirus? No, please do not stop taking your drugs. Immunosuppressant drugs are vitally important for people that are taking them to suppress some part of their immune system that's causing them disease. The sequelae of not taking, or the result of not taking those drugs, is much more severe than coronavirus in most cases. We really want you to just consult with your doctor. If you are immune suppressed or one of those people that are in a high-risk category, have a conversation with your doctor. You probably will have already had a conversation with your doctor about flu and about all the other seasonal infections that happen, and it's the same plan. So whatever plan you had for during flu season with your doctor managing your chronic disease is the exact plan you'll have with coronavirus. But if you have any questions, certainly consult your doctor before you discontinue any medications. Wow, I think that's really important. You even said, right, if you are even on these kind of drugs, like maybe it's a good time to get in touch with your doctor, right, just to check in. All right, so reminder, if you have a question, we're answering those live for you on the coronavirus. Next up, we got a question. Is it possible that I could be a carrier of the virus and never know? And if I don't have symptoms, am I infectious to others?
Yeah, so this is a difficult question to answer because, honestly, technically, you probably are symptomatic, you are contagious even if you don't have symptoms. But keep in mind that symptoms are the major way that the virus transmits itself from person to person. So, if for instance, I was sick and didn't have any symptoms, we probably shouldn't share a toothbrush because I would transmit the virus to you. But if I'm not coughing, I'm not sneezing, and I'm not putting these respiratory droplets onto surfaces or directly in contact with you, it is extremely difficult for me to get you infected, even at this distance, very close, 2 feet away from each other.
That's interesting.
So really, the more symptomatic you are, the more likely you are to transmit the virus. And that's one of the reasons why these masks are so important for our healthcare workers taking care of patients in the ICUs, because those patients are really the highest risk for creating lots of little contagions that can infect our healthcare workers and frontline staff.
It's interesting you say the 2 feet apart, right? Because we've been hearing a lot of, 6 feet?
Right.
People are asking to keep 6 feet away.
Right. So that's the metric that we're using, because that's about where the respiratory droplets can make it to for 6 feet. But I'm saying without any symptoms, even 2 feet away, you're really safe. So if I'm not expressing any symptoms at all, I'm not really transmitting. There's nothing that I can generate that would transmit the virus to you.
So I feel like we've been hearing a lot of like symptoms, the word symptoms. Let's backtrack and kind of, if you can, walk us through what are those symptoms we should be looking out for.
Yeah, so the main symptoms are, and especially, this is especially important for as we're coming into allergy season, so we can't just say if you have a runny nose, you have coronavirus, because a lot of people are going to start developing runny noses and sneezing from just allergy symptoms. So really the hallmark of this is, of a viral infection in general, is fever, chills, muscle aches. If you have any of those symptoms along with a cough or a runny nose, that would be very concerning that you could be developing coronavirus, in that you should distance yourself if the symptoms are mild, stay at home and get better. It doesn't require medical attention universally, but if certainly if you're in one of those high-risk categories, or you're having difficulty breathing, or if you feel like you're having severe chest pain, those are reasons to go to a hospital for severe symptoms.
Nice. So I told you guys, right, we've been answering y'all's questions over the past couple of days. Someone yesterday wanted to know, how do I even bring it up to my boss? Like, hey, like I might need to stay home, or even can I stay home? So that's just an idea of some of the questions we've been answering over these past couple of days. But it looks like we have one on YouTube, one of our YouTube viewers. So our producer, Jessie Edwards, she's over on the side writing. You can't see her, but she's there. And she wrote that one of you all wanted to know, how long does COVID-19 live on surfaces? How long, doctor?
So it's a difficult thing to answer as well. Unfortunately, a lot of these the answers are it depends. For most surfaces, once it dries, it's going to be inactivated and die very quickly. So a matter of minutes to maybe hours. Obviously, if it's in a more moist surface where the surface is going to stay moist, like in a sauna, it's going to last for much longer than that. But this is one of those viruses it's pretty easy to kill. So on surfaces, it's any disinfectant will work to remove it, and then even being out in direct sunlight and drying in the sun would kill it. So it's not going to last for weeks and weeks and weeks on most surfaces.
Interesting. I'm actually pretty glad you brought up the sauna thing, because I feel like people might think, oh my gosh, I'm so stressed hearing about coronavirus. Maybe it's a good time to head to the spa, go inside of a sauna. But now I'm having second thoughts.
Yeah, I mean, I wouldn't recommend steam rooms right now. They're not necessarily niduses for infection, but they're also not the best place to be if you've got symptoms.
If we can keep
symptoms,
away.
You should be home, resting.
Yes.
Yeah.
Awesome. All right, next up, again, just a reminder, we are taking questions live, so live that the doctor here has some ringing, right?
Sorry about that.
I love it. Guys, he is on call and he stopped in, so we really appreciate you coming
my pleasure.
in. All right, so our next question from our viewers, one wanted to know, are communal washing machines unusually risky at a time like this? And before you get to this, I'm curious.
Yeah.
You're probably jammed busy with your schedule right now, I'm sure, as a lot of doctors are. I mean, what is it like? Let's just take a second. What's it been like for you?
Yeah, I mean, so my kids keep joking that I'm either living at the hospital or living in the television. So they're 4 and 2, so they're young. But we've been busy. All healthcare workers right now are very busy. We've been working, 18 to 20-hour days, trying to make sure that people stay safe. So absolutely, it's been a rough time, but this is what we signed up for. This is kind of why we went to medical school and nursing school. So
incredible, and taking time to answer y'all's questions, we really do appreciate it. Okay, back to what I was saying, right? The question we got, are communal washing machines unusually risky at a time like this?
No, absolutely not. So COVID-19 will not stay on the surface of a clothing after it's been washed. The high volume of water passing through it, the soap, it's going to kill it and wash it away. You can use communal washing machines. You can wash your clothes in the same house with a family member that has an infection. It's not a risk.
I am learning so much. Honestly, I didn't even think of that question. That was a really good one for whoever asked that about the washing machines.
Yeah.
Because it's true. Like, we live
These
in
are
New York
things people
City.
don't think about, yeah.
Okay, I mean, how many of us have in-unit washer and dryers?
Right. Thank God it's not a risk.
Right? Oh, well, that's good to know. All right, so next up we have another question. Tamala from Facebook. Tamala, hey, thanks for watching. So Tamala wants to know, will having had a pneumonia shot protect her from a COVID-19?
So the short answer is no, but the longer answer is actually yes, because if you don't get pneumonia, you won't have to go to an emergency department or go to a hospital where you could be exposed to COVID-19. So it doesn't protect at all against COVID-19, but not getting pneumonia all the time is a better idea. So get your flu shot, get your pneumonia shot. Those are vitally important to keep you out of hospitals right now when people who can't get the vaccine for those things or get COVID-19 where there's no vaccine have to come to the hospital. Nice. So absolutely. Get the shots.
Awesome. Tamala, I'm glad you asked that too, because I feel like in addition to pneumonia shots, I mean, what about like over-the-counter things? I would imagine are people like, hey, maybe I'll take, some of this or some of that and hopefully keep coronavirus at bay?
Yeah,
Is
there's,
that advisable?
there's lots of home remedies that people use, grandma's cure for the flu and things like that. I mean, they're certainly not harmful. Most of them are not harmful.
Yeah.
So if it's worked for you in the past, by all means. Some people like zinc. There's no real evidence base behind any of this, but certainly if you want to use it, it wouldn't hurt.
Nice. And doctor, where are we at as far as, any legit remedies and actual, the name is slipping me, but to prevent getting the coronavirus?
Yeah, so vaccines or prophylaxis. Yeah, so
vaccines, where are we at?
not for this epidemic. I mean, essentially next time we'll be ready, but right now we're at least 12 months away, probably longer. We need to make sure it's not just that we're not releasing it, right? We have candidates, we need to make sure they're safe, and then we need to make sure they're effective. And so that process takes time, and unfortunately it's not going to be in time for this epidemic.
All right, so y'all heard that TBD on the vaccines. Gotta note that vaccine, yes. All right, so we have a comment from one of our YouTube viewers, and this person wants to know, is COVID-19 airborne? Is it out there in the air?
So airborne is a very specific term that we use to describe something like the measles virus or tuberculosis, where they literally will hang in the air. So, if I cough and I'm in a subway car and then I leave the subway car and someone else comes in, an hour later, they can get measles. COVID-19 is not airborne, so it's droplets. So the droplets don't hang in the air; they fall to surfaces very quickly. That's why we use that 6-foot rule. So if I'm coughing and I'm right in front of you, yeah, I could probably get some droplets on you and you could get infected. So it does travel through the air.
Doctor, you'd be too close.
I know.
Too close.
It does travel through the air, but it doesn't hang in the air, and it's not like I could cough and then that air is now contaminated and needs an air change before someone could come in and get it. So it's mostly these droplets are landing on surfaces, or touching those surfaces and then touching our faces.
Interesting. And when you say droplets, like in my mind, I think of like saliva. Is that what we're talking about?
Yeah, it's saliva, it's phlegm,
Okay.
it's kind of all the secretions that happen from our noses, our nose and our mouth. It's from sneezes, from coughing. It's kind of all those kind of respiratory secretions and everything in between. Yeah.
Interesting. Well, just a reminder. Let's take this moment, right? You cough into the elbow, right?
Yeah.
Okay.
Or a tissue.
Or a tissue.
Yeah.
All right.
Disposable tissue.
Not out in the air, folks. Okay. No. Next up, we have another question from one of our viewers, and another reminder for you all: if you are watching this or where you're watching this, comment below. We are taking those questions live right now with the doctor in studio here. So someone asked. We're hearing news stories now about people who are in their 30s and their 40s being gravely ill. Some people having even died already from this coronavirus. Is the virus getting stronger or worse as it spreads?
No, I think the news coverage is getting more intense, and we're obviously hearing about the severe cases, right? And we're not, because of privacy laws, we're not able to say whether someone has an immune compromising condition or any other condition that may be their personal privacy. We are seeing people with those 5 conditions, those conditions that are basically putting them at risk, and people over 60 are at risk. Fortunately, children seem to have been spared so far from this epidemic, and worldwide, no one under the age of 15 has died from coronavirus, which is very different from a flu epidemic.
Interesting. Do we know why that is? Like, why is it this weird age? I mean, where are we on the science for that?
Yeah, we don't really know. Most viral issues cause kind of the extremes of age, so over 60 and under 5 definitely get hit most severely. Children just seem to have been spared from this, and we'll have to do an analysis after the fact about why that was and what about this particular virus doesn't affect children. I'm very thankful that it's not affecting children, and it's kind of one of the things that we've been spared. Children and pregnant women, which normally are people that get affected by flu and are at risk for flu, don't seem to be at risk at any increased risk for COVID-19.
Nice, right, and as a parent yourself, that's so true,
Yeah.
so true. And again, we've been answering these questions over the past few days, a variety of themes, right, for families who have young kids, travel questions. We've been taking all of those, so, and we really appreciate y'all who have been sending them in. All right, David from YouTube. Doctor, David is trying to stay up in the gym, but he wants to know, is it safe?
Yeah, I mean, this is one of the things where it's always a risk benefit. So, if you're immune compromised and on immune suppressant drugs and you're over 60, should you go to the gym? Probably not.
Yeah.
But if you're, a healthy person, healthy guy or gal, and want to continue your gym routine, yeah, wipe down your machines before you use them and after you use them. Try to stay with greater than 6 feet from other people. Certainly don't go to the gym if you're feeling sick or having respiratory symptoms. But yeah, we want people to continue going to the gym. That's an important part of our daily lives and our fitness.
Yeah, to stay healthy.
Yeah.
All right, so David, take note, okay? If you're not feeling well, maybe don't go. But also if you're there, 6 feet, and make sure those equipments are clean. All right, we've got another question here from one of our viewers. Someone wants to know, if you work in a factory or production line, right, and handle bottles or liquids, could you pass the infection on to the bottle or into the liquid? So basically by touch.
Not really.
Where are we at?
Essentially, not really. No. So most likely, those particles, if you were infected and working on a factory line, number one, oftentimes these factories have infection controls. They're going to either expose the bottles to UV lights or something that would inactivate any bacteria or viruses. So that's usually a standard part of production. But the second part is that it just logistically couldn't survive for long enough to infect you. It's going to go through so many different kind of layers of production and get shipped. So this worry about kind of Amazon packages arriving from China, things like that. Please don't worry about that. That's not a mechanism by delivering the virus. It's just not realistic. It's not going to happen.
Yeah, that's really good, and I'm glad you bring that up too as far as travel goes, because I mentioned although we have been answering those questions over the past week, it doesn't hurt to go over them a little bit here, right? Any travel tips for people who are making plans?
Yeah, I mean, so, obviously weigh the importance of travel right now. Obviously, travel is one of the things, especially air travel, where, you're going to be in close contact with other people. Certainly, if you're over 80, I don't think this is a time to get on an airplane. And I think the CDC has supported that. But for most young, healthy people, this isn't really this isn't going to really drastically affect your life. I wouldn't, and we also think this is going to go on for some time now. So, obviously use your best judgment, but there's no direct contraindication to someone who's young and healthy going on travel.
Got it. And we are listening. There was an article on NBC News actually that showed that young folks, we are not afraid apparently of this coronavirus because these flights are so cheap. We're like, why not? I'm curious, is that how y'all are feeling? Comment. I'm very curious to see if we're all on the same page with that, because I don't know where I stand. Yeah, so
the flights certainly are cheap, and with $0 cancellations, I mean, that's a great thing.
I want to take the chance. All right, we've got another question here from Camila on Facebook. And again, a reminder, Camila, thanks for commenting. We have our producer, Jesse Edwards, on the side. She is writing y'all's questions down. So Camila wants to know, what conditions put you at higher risk?
So the conditions that put you at higher risk are essentially diabetes, heart or lung disease, immune suppression for any reason. So either you're taking immune suppression drugs or you have a compromised immune system because of an illness, and being just above 60 years old, or cancer, active cancer that's not in remission. Those are kind of the ones that seem to be falling out as higher risk of death. Certainly, if you have any of those conditions, you should have a plan formulated with your doctor about what to do if you get sick, where you're going to go, who you're going to call. We want people to call ahead as much as possible in advance to their providers instead of just showing up to healthcare facilities. And obviously, if it's an emergency and you feel like something comes on suddenly, that's what emergency rooms are for.
Awesome. Emergency rooms are for. Doctor, any last tips or advice or something, our viewers or myself didn't get a chance to ask you that you think we should know?
I mean, the big thing is just we've got to kind of keep cool heads about this, remain calm. For the majority of Americans, this is going to be a mild to moderate symptom illness where you're going to get better at home. It's not going to require any intervention from a doctor, any medication that's special. It's going to be just kind of grandma's chicken soup, Tylenol, Motrin, and rest. So the biggest thing about this is, I've been saying this over and over, is that the fear is growing faster than the virus. So we've got to stay calm and recognize that we need to protect the people that are at risk, of course, but the majority of us, we're going to be fine.
Fear is greater than the actual risk. We've been hearing that from Governor Cuomo, which we've been following over on our website and on our station, right, with News 4. So you all can be sure to keep up with those updates every day. We have it also on our app if you haven't already downloaded that. Thank you, Doctor, so much for being here, Dr. Cioe Pena, and you all for watching from wherever you've been watching, right, YouTube, Facebook, and if you joined us prior to this on Instagram Live and you made your way over, shout out to you, okay? Thank you so much. And we'll be sure to keep these answers coming for you all throughout the rest of the week, so ask them, please. Thank you.
Sounds good. Thanks.